Hello, everyone. This is Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you all know, this is a webinar where we're going to discuss Lyme disease. And as usual, you're going to create the webinar with your questions. Oops. See, I got a little smoothie on there from a little bit earlier. Hold on here, one. Anyhow, on both sides. I guess I should have stood in front of the mirror a little bit tonight before we came on here. Anyhow. I look forward to helping you tonight, and I'm actually visiting with you today from my new office in Seattle, Washington, where in about a little over a week, we're going to start seeing people in person for the first time in 2.5 years. And so I'm very excited about that and look forward to being able to offer that as another way that I can help people. If any of you are so inclined, I'm here in Seattle, Washington, and taking appointments. And I'll show you where you can set up appointments later today as well, too. So for those of you that are new here in the webinar, the way that you participate, there's two ways, even for those of you that are returning. The two ways you can participate, number one, is you can write a question to me. And the way you can do that is in the chat box. What I want to let you know is the chat box, I'm having it so that everyone can see what is written. So if you try to correspond with each other, everyone's going to see that correspondence. So I would urge you not to do that and just save that the chat is for people writing questions, okay? All right. During the webinar, so that's one way to participate. The second way to participate is just to see what kind of questions people have and how I respond. There's always a lot of good learning that can take place just by doing that as well, too. I am creating a recording of tonight's webinar sometime later tomorrow morning. I've stopped trying to say I'm going to have it done by 10 a.m. because I just don't. But later tomorrow morning, we should have that up and ready for you to see. And you'll get an email notification from me that it is ready to be seen as well, too. Okay. And then finally, just be aware. There's a lot of questions here. I never can get through all of them. I get through a lot. But I'll try my best to get through as many as we can tonight, too. So if you, I know I occasionally hear from people that get frustrated because they think I'm avoiding their questions. I don't avoid anything. I generally take them as they come one at a time. Okay. All right. So without any further ado, let's get started. For those of you that are participating in the live version of the webinar tonight, you'll actually be able to see the questions on your screen. They display there for you. Okay. And but for those of you that are not in the live version, I actually read the questions out loud so you can see what we're talking about. So let's go ahead and get started here. So this first question is from Patsy. Hello, Patsy. Let's see. Hi, Dr. Ross. I hope you are well. I am. Thank you. Let's see. I have a few questions. If one gets a rash from a tick bite, does the rash appear at the location where the bite took place or somewhere else in the body? 2, do we know why some people get neuro-Lyme and others get Lyme arthritis or Lyme carditis? Is it dependent on the strain of Lyme? 3, what is the best way to determine whether or not someone has Lyme disease versus another autoimmune disease like MS? Thanks so much for all you do for Lyme sufferers. You're welcome. Those are some good questions. I'll work through them in order, okay? So the bullseye rash, or the classic bullseye rash, it looks like a bullseye, usually is going, or rashes that are similar to the bullseye rash usually are going to occur near the site of the tick bite, but not always. They can sometimes occur in other areas of skin away from that tick bite, although the most common area is around where the tick bite took place, okay? All right. And then number 2 is do we know why people have, I'll call it, different presentations of their Lyme? So some people have more of a neurologic presentation, some get heart, some get arthritic conditions. The answer is no, we don't know why. I wish we did, but how Lyme presents in one person is always different than it presents in another person. And I think it has to do with, for me personally, I think it has to do with a number of reasons. Number 1, all of us have immune systems that work a little bit differently on this thing. Number 2, some of us have more problems with toxins than others. Number 3, we all have different stressors in our lives that determine how our immune system works. I mean, I can go down a list, but we're all very individual. And so therefore, it would make sense that how this illness manifests is going to be different in different people. And so, no, I haven't seen any data that would suggest it's related to the strain of the Borrelia. It's a good question, no. And then in terms of how do you determine if somebody has Lyme or an autoimmune illness, it gets tricky. So when you have Lyme, it is possible it can trigger autoimmune illnesses. And it's also true that sometimes independent of having Lyme, you can have autoimmune illnesses. Okay, so, and there's really not a clear way of telling which is which. So sometimes I will, like in my situations where people have multiple sclerosis, I might say they have Lyme disease, making their triggering multiple sclerosis. I might sometimes say that it's Lyme manifesting as multiple sclerosis. I might say that they have Lyme and multiple sclerosis. I mean, I think it's all valid things that you can go ahead and say. I do think for some people that their MS and other autoimmune conditions like rheumatoid arthritis, lupus, those things can sometimes be caused by having tick-borne infections in you. Okay, all right. Thanks for the questions, Patsy. Hello, Jim. Let's see. Thanks again for these great webinars. You're welcome. I'm having a problem with dizziness, most notably when I'm scrolling on my laptop. The problem seems to be related to my getting off lorazepam as a sleeping pill 2 months ago, as it seemed lorazepam was providing support to my nervous system. I'm now taking 100 milligrams theanine, 400 milligrams of magnesium glycinate, and 750 milligrams GABA daily to help with sleep. When I had this dizziness problem before, my doctor suggested taking GABA, and that seemed to stop the problem. But she also said if I take too much GABA, it could cause symptoms. So now I'm not sure if the GABA is still helping or if it's now contributing to the dizziness or if it's not a factor. Anyway, do you have any thoughts on how to solve this dizziness issue? I should also mention I'm 9 months into treating BART and Lyme with Methylene Blue and diflucan, though I do not think that is contributing to the dizziness. So Jim, I hope that you had somebody that's an expert in dizziness evaluate you to see whether, and I assume you probably have by now, but to make sure that your dizziness is not an independent entity from the tick-borne illnesses, okay? So dizziness can be sometimes neurologic, sometimes it can be a manifestation of inner ear problems. And so I would hope that you've seen probably neurologist and or an ear, nose, and throat doctor that can help look at, is there an underlying cause that can be corrected that's separate from having tick-borne infections, okay? So I just want to make clear about that. The other thing I would point out is the benzodiazepines, in which the lorazepam you're describing is a benzodiazepine. They can be effective at helping to treat dizziness. When we get people that have vertigo, that sometimes it is the treatment that we sometimes have to use if things like meclizine, which is an antihistamine, don't work. Sometimes we can look at using benzodiazepines so they can help manage those symptoms. Now, interestingly enough, where the benzodiazepines work is they bind to a brain receptor, which is called the benzodiazepine GABA receptor. So that receptor will bind both benzodiazepines, it will bind GABA, it will bind GABA analogs like gabapentin and Lyrica. So those anti-seizure medicine times will bind there too. L-theanine is turned in the brain into GABA, and then you're taking GABA. So those things all presumably could help. The one thing that we're starting to realize for a sector of people is that being on long-term gabapentin or even Lyrica may lead to some difficulty with thinking, as those GABA receptors have been bound up by GABA over time. And it's a newer phenomenon, I think, that we're starting to recognize. And so many of us are being a little bit more careful with that. I haven't seen any data suggest that being on L-theanine or GABA is going to lead to that problems, but I just want to make you aware we are seeing some data within the world on gabapentin and even on some of the long-term use of benzodiazepines like clonazepam, for instance, that bind to these GABA benzodiazepine receptors. So we have to be careful with these things as well too. All right. So Jim, I don't have a specific answer for you about how to proceed other than I think you need to talk to your doctors out there a little bit more. And I think that you need to probably make sure you've seen an ear, nose, and throat doctor and seen neurologists along the way that can help look at alternative ideas as to why you have the dizziness beyond looking and thinking that this is just tick-borne disease related. Okay. All right. Good luck to you, Jim. Thanks for the question. Hello, Erica. Say hi, Dr. Ross. My doctor put me on Tafenequine with a loading dose of 600 milligrams over 3 days, then 200 milligrams weekly. Is that strong enough weekly dosing for resistant Babesia with the Zithromax and Mepron? I have had ongoing failure treatment of Babesia. I never had night sweats or shortness of breath, but tested positive for Babesia microti and genus, but negative on the Odocoilei T-Labs test. Can you also treat for Bartonella, also on Fluconazole and Methylene Blue, or is this too much for the liver? Let me just make a few comments here. So Tafenequine, everyone, is part of a family called the quinolines, all right? And within that family is Tafenequine, which is the new wonder kid on the block, and then Primaquine is another one as well, too. Primaquine is a little longer, has been with us a longer period of time, and actually is more short-acting. So the thing about Tafenequine is it has a very long elimination half-life, the amount of time it takes to get out of your body. And it takes literally 2 months for it to completely leave your body. Now, things that have long elimination half-lives also do not need to be taken as often. And most of us, I think, in the world of treating Babesia have fallen on a schedule of using Tafenequine once a week when we're doing it, all right? I can understand why your provider might have done a loading dose. I usually don't. I usually just let time. The longer you take a medicine, what happens whenever you take a medicine, the level goes up and then starts to peter down. Then you take more of it, it goes up higher, it starts to peter down. And eventually you go up to a high level and just kind of keep oscillating at that high level, all right? In a medicine that has a long elimination half-life, what we recognize is it takes about 4 half-lives to get up to a steady state. So in a case of Tafenequine, that might take 1 to 2 months of regular dosing before you get up to a steady state here, okay? What your provider was doing by having you take 600 milligrams over 3 days is trying to load you up to this higher dose so that you can better maintain it there now. I generally don't do those loading doses, and the reason I don't with Tafenequine is a lot of people can get into Herx reactions from it, and so I like to let it gradually build up to these higher levels by just taking a regular dosing of it, okay? And the dosing that I tend to try to work in an adult is 300 milligrams. That's not to say 200 milligrams isn't going to work for you, okay? But I tend to go more for that 200 milligram dose, basically, okay? I'm sorry, 300 milligram dose, all right? And then, yeah, combining with Zithromax and Mepron is a strong treatment. We tend to do that more in the strain of Babesia called Babesia Odocoilei, which tends to be your harder to treat strain. Babesia microti and Babesia odocoilei tend to be a little bit easier to treat. Standard 4 to 5 month treatments usually will work fairly well for those. Babesia odocoilei, for various reasons, sometimes can take just a longer period of time. It likes to wrap itself up in fibrin. It likes to sequester itself, hide away deep within your system. It's just a harder thing to treat. And so we tend to use a more powerful medicine, which is that Tafenequine, okay? All right, and then in terms of treating for Bartonella at the same time, you got to be careful because the Zithromax or the Mepron is cleared by the liver as well. Tafenequine is going to stress the liver. Fluconazole would stress the liver. That gets to be a little bit of a more difficult treatment on the liver. You could do it. You could do that, Fluconazole, Methylene Blue with everything you're doing. But if you were to do it under the guidance of a physician, they would probably want to do some pretty regular liver function testing to make sure that your liver is holding up okay to this, okay? All right. Good luck to you, Erica. Hold on here a minute, everyone. I'm just getting buzzed all over the place here all of a sudden. Got it. Okay. So anyhow, let's see, Mira. Hi. Do you recommend taking Biocidin LSF and capsules together for Lyme plus SIBO complication? Thank you. Interesting question. So a Biocidin, everyone, is an herbal medicine complex. I call it a complex because I think it's got about 10 different herbs in it. And it has a number of formulations. So there is a liposomal variety where a liquid version of the herbal extraction is microscopically wrapped in fat to increase absorption, to get absorbed into your body, basically. All right. So that's liposomal or Biocidin LSF. Biocidin LSF or Biocidin, the herbs that are in it, have the ability to both kill Borrelia. They may kill Bartonella as well too, because there's some oregano and garlic in there that would probably have activity against the Bartonella as well too. Okay, as well as having activity against Borrelia. And then Biocidin is also very useful against biofilm, probably Bartonella and Borrelia. All right. So to treat Bartonella and Borrelia, you would want it to get absorbed into the bloodstream and leave minimal amounts behind within the intestines. All right. Alternatively, the components that make up Biocidin are also very good at treating small intestine bacteria overgrowth, also known as SIBO. All right. And so for treating SIBO, on the other hand, managing SIBO, on the other hand, you would want to make sure that your herbal medicines are staying in the intestinal tract and not getting absorbed so much into the bloodstream, so you have a better chance of killing the organisms that are there. So you could make an argument for doing both the Biocidin LSF and combining that either with Biocidin capsules or Biocidin drops. Okay, so the Biocidin drops and capsules are not liposomal, therefore not going to be absorbed into the bloodstream as much. All right. Now, keep in mind, even though the liposomal is better absorbed, that still means some of it stays in the intestines. And even though the drops and the capsules are not tend to stay more in the intestines, some of it is absorbed. All right. So, one way you could look at doing this if you want to do it would be to consider, and again, talk with your provider about this. I hope you all realize that I'm just giving you advice to consider, but I can't be your physician. I don't get to interact with you here. So this is just advice for you to consider, especially talking over with your providers too. But you might look at like a standard Biocidin LSF would be to do 1 pump 3 times a day, and your so what you might do is like maybe 1 pump twice a day. So go a little lower on that, and then combine it with like 1 capsule 3 times a day of your Biocidin capsules, or 1 dropper full 3 times a day of your Biocidin liquid. So you might just drop the LSF dose down a little bit while you're on the pills or the drops, because normally I would do 1 pump 3 times a day on the Biocidin LSF for treating Borrelia. Okay. All right. I hope that answers your question there. All right. For those of you that aren't familiar with Biocidin LSF or Biocidin and the formulations, let me just do a quick screen share here with you. All right. So this is my information site, Treat Lyme by Marty Ross MD, and here is my Lyme guides. And then over here is my supplement store with products I recommend that I have found very effective in my practice as well too. Okay. All right. Now, in terms of the Biocidin, I have a review article that I have written. Let me see if I can find it here. Or maybe I don't have that review article anymore. Huh. I may have gotten rid of that article. There were some problems with it. I may have gotten rid of it. Let me see in one other place here, just a minute. One more page to look at here. Yeah, it looks like I don't have that article anymore. Anyhow, sorry about that. All right, let me go back here. All right. All right. All right, let's see. Hello, Mira again. Let's see, does cholestyramine help bind Lyme and co-infections? So Cholestyramine, everyone, is I call it a fat sponge. It was designed originally to treat high cholesterol by absorbing and sponging up cholesterol with your intestines so it didn't get absorbed. All right. We use it in the world of tick-borne infections for a couple reasons. So some people with tick-borne infections get mold toxicity, where their immune system is not able to break down mold toxins. Those toxins get passed into the intestines. And then to prevent those toxins from being reabsorbed back out of the intestines, we try to bind them up in the intestines using cholestyramine. All right. So that can be done. Cholestyramine can work in that situation on both mold toxins. And there is an argument to be made for some people that their systems may not be able to break down Lyme toxins either. And cholestyramine for some of those people may be able to help bind up those Lyme toxins as well too. Okay. But cholestyramine is not binding germs. All right. So it's not part of removing Bartonella germs or Babesia germs or Borrelia germs from your system. We don't think it has any activity against that. Okay. All right. Good luck to you, Mario. Hello, everyone. Let's see. Hi, Sandy. Let's see. I have late Lyme, 1976, much worse now with many autoimmune issues. Have all three, Bartonella, Babesia, Borrelia, 3 years ago. Couldn't eat for months, vomiting. Found I had H. pylori, several fungus and bacteria. Told it's about 50% better now. I'm having a leaking gut too. The doctor says I am completely full of inflammation, including Epstein-Barr at 750 test, and can not get to drop. Now, if I eat gluten or drink even a sip of alcohol, even gluten-free, I vomit for hours. I currently take gut feeling, which gut feeling is a peptide compound that has BPC 157 and some other peptide products in it to help soothe the gut. Cinnamon, clove, oregano essentials, polyphenol booster, Mega Pre, Cryptolepis, Japanese knotweed, glutathione, glycine, curcumin, phytosome. Questions. If you can answer for me, can you please advise me as to what else I should add or eliminate, as well as best dosage, etc.? I really could use your suggestions. Also, do you think the BPC 157 alone would be the best instead of gut feeling, or any other peptide that you would feel would help me too? How long do you stay on peptides? All right, so Sandy, this is, let me just make sure there wasn't a second part here that you posted. All right. So this is kind of a complex situation, right? So the one thing I want to let you know, see, you say you vomit for hours when you have certain foods. All right. So I want to raise an issue with you that you need to consider with your physician. So if you've got ongoing gastritis, meaning inflammation of the stomach lining, that could lead to a lot of stomach irritation and vomiting kind of situations and pain from taking medicines, all right? If I look at the current medication supplements that you're on, the cinnamon, clove, oregano are volatile oils, and they can be very irritating to the lining of the stomach. I just want you to be aware of that, okay? In addition, the alcohol content that is in the Cryptolepis, Japanese knotweed tinctures can be irritating as well too, all right? So in situations like this, I consider when somebody's got a lot of GI upset and yet we still need to leave them on these herbal medications, if that's your choice to stay on those, and if your doctor is still recommending that, and again, I want to be clear about that if, okay, then what you might want to do is you can make those a little bit more tolerable. So for your alcohol tinctures that can be irritating to the lining of the stomach, what I like people to do, I'll have my patients steam off the alcohol. So the way you could do that is like on your Japanese knotweed, you would take your 30 drops of it and you would put the 30 drops into water that was just boiled and then let it cool down and then drink it. So like maybe 1 or 2 ounces of boiled water, put your drops in there. And then what happens is a lot of that alcohol steams off, all right? And it makes it so it's more tolerable to be able to take then. You don't find it quite as irritating on the stomach lining then, okay? All right. And then in terms of cinnamon, clove, oregano, that one's kind of gets tough. What I will do sometimes in situations like this is to try to cover the stomach lining and protect it so that these things are not irritating to the stomach lining. And one of the things that you can use that is soothing and protects the stomach lining is to use a form of licorice, which is called deglycerated licorice, all right? And so what I usually will do is have people take that before they take their cinnamon, clove, oregano, if they've got a lot of irritation from that, and even before taking the crypto, as well as the Japanese knotweed too, all right? And so the product I like using for that is a product made by Integrative Therapeutics called Rhizinate, Rhizinate. It's got licorice in it. When you chew licorice tablets, your saliva interacts with substances in the licorice, resulting in a microscopic gelatinous coat that coats your food pipe, coats your stomach lining, okay? And so it can be protective, and it can make it so you can tolerate some of these irritants more easily as well too, all right? So before I would suggest or make comments to you about other things you might add, I would see if you can make what you're taking more tolerable first. And those are some ideas. Again, talk it over with your physician to make sure this is something that's right for you to do as well too, okay? And then in terms of the BPC 157 and gut feeling supplements, I'm gonna do a screen share and look at together with you what is in the gut feeling versus BPC 157, all right? So let's go, I'm gonna look at the products on my site. And so we'll look at the research nutritionals. Where are you? There we are. No, I'm sorry. Integrative peptides, excuse me. All right. And so Integrative Peptides has three products called gut feeling. All right. There's a gut feeling mango, gut feeling orange, and just pure gut feeling. And I'm just going to look at the gut feeling. Essentially, the peptides that are in these are the same. All right. And so in terms of what is in the gut feeling, we've got, I'm looking sideways here, you've got BPC 157, which is a peptide that can help repair injury to the intestines and helps them work well. There are other things BPC 157 does too. We think it helps support mitochondria function. It helps support immune function. It can do tissue repair, as in muscles and tendons, and even neurologic repair, okay? It also has KPV, which is your second peptide that is in here. And KPV is very useful in decreasing inflammation and also stabilizing your allergy cells called mast cells. Sometimes when people get irritated stomach, it's because they're having mast cell reactions within the stomach due to leaky gut that releases all these histamines, and that can be irritating. So the KPV can help with that too. And then within here is immune peptide A2. And immune peptide A2 stimulates the immune system, or the thymus gland, and helps your immune system work better, possibly within the gut lining to help soothe it as well too, all right? Finally, within this complex is Akkermansia, which is a keystone bacteria that provides signals to the rest of the bacteria to grow well in the intestines. It helps lead to the production, along with the lactospore and the fructooligosaccharides and inulin. It leads to production of butyrate that can be very soothing and help. Butyrate is a key fuel source for the intestines, and having more butyrate helps heal injured cells that line the intestines as well too. All right. So if you've got a lot of GI stuff going on, I sometimes prefer this product over just straight BPC 157 for all the reasons that I just mentioned there, okay? And then in terms of this, this Rhizinate product that I was telling you about, it is an integrative or therapeutics product. And so there are two varieties of that. There's this one, and another one. This one is fructose free, and the other one, it has some fructose in it, okay? But you would chew 2 tablets of this before taking your stomach irritants, at least maybe 2 or 3 times a day, okay? All right. All right. That's a lot to talk about. I hope that gave you information you'll find helpful, though. All right, let me just see something here. Okay, hello, Jacqueline. Let's see, my 15-year-old daughter has been very sick for 3 years, extreme fogginess, feels like she's in a dream, can't think clearly among many other symptoms. Last year, we learned of mold toxicity via real-time labs mycotoxin tests. This summer, she was diagnosed with Bartonella via MDL and Western blot. She's extremely sensitive to binders and treatments, so we have been at a standstill. She is on KPV peptide and minerals and B2, trinystatin and therabiotic candida complex, and her symptoms flare terribly. How do you treat when somebody is so sensitive? We've tried microdosing everything. Could candida still be a big factor? GI map shows very high candida last year. All right, so without getting into the specifics of your daughter, there's a few things, principles that I can talk about, all right? So when somebody has a lot of sensitivity, there's 3 things initially in a treatment that I like to focus on, maybe 4 things. But number 1, there usually is a component of what is known as mast cell activation syndrome, which is your mast cells, which are the allergy cells in the body, become reactive and release histamines and cytokines against everything, okay? So one of the principles we like to do is do things to stabilize the mast cells. The KPV peptide is one thing that can do that. Another thing that can do that also is quercetin, all right? Quercetin is a bioflavonoid that is found in onions and in color, the skin of colorful fruits and vegetables, and it helps stabilize your mast cells so they're not as reactive and releasing their histamines. A second thing that we'll also do usually is get people on an antihistamine like a Zyrtec to block the histamine receptor. So the 2 essential steps in mast cell activation is stabilize your mast cells with a mast cell stabilizer like a quercetin, and then use some H1 blockers, histamine blockers like a Zyrtec, or a Claritin can sometimes be helpful there too, okay? Second thing to consider when you have mast cell activation is what in the intestines could be really turning on those mast cells that line the intestinal tract, although mast cells are found everywhere. But keep in mind, 60 to 70% of the mast cells in the body are found in your intestinal tract. Or I should actually say 60 to 70% of the immune cells in the body line the intestinal tract, all right? And if you have too many yeast in the intestines, that's going to trigger allergic reaction within the mast cells, which is going to make them further trigger happy to release their stuff to any stimulus. So yes, I also like to look at yeast, and if it's there as part of decreasing sensitivity, stabilizing mast cells, I like to focus on that too, okay? Number 3, when somebody has this kind of reactivity, we also wonder about whether their limbic system has been too turned on. So the limbic system is part of your brain that's in charge of your flight or fight response, your reproduction. It gives us the drive as to whether we're going to eat. And if it's too trigger happy, you get all these adrenaline rushes as well too. In people with chronic tick-borne infections that are either early in their treatment that have been very sick for a while, the limbic system can get stuck on. Or if somebody's even knocked down a lot of their germ load and they're still not fully recovering, we sometimes think that the limbic system is too turned on too. And so there's some things we can do about that, all right? So one of the foundation things that you can do is retrain the limbic system. And there's a number of programs out there that do that, but essentially you're learning to do things to calm triggers that stimulate you. So you can do things like meditation. You learn breathing exercises. You learn ways of reframing the things that scare you so that you're just kind of gradually tuning that part down, okay? So programs that do that kind of thing, one is a program called Primal Trust. That's PRIMAL. That's one, okay? There's another method called the Gupta method, which tends to be more meditative, if you will. And then there is another program designed by somebody named Annie Hopper called the Dynamic Neuro Retraining System, or DNRS. And so all three of those may give a person benefit, all right? So you may want to just read online, Google those, and see which one resonates with you. Each program can work. Each program is not necessarily for you, okay? So for instance, the anti-hopper program I think is very beneficial, but it's more boot camp-like. It's very regimented, okay? Gupta tends to be more meditation-oriented. Primal Trust, a lot of people have used that. They find it kind of to be an in-between program that works pretty well, all right? So you need to kind of calm down that agitated part of the nervous system called the limbic system that's causing an over-release of your adrenaline systems and overactivity there and just reactiveness. You need to calm that down. Secondly, as best as you can, you need to stabilize the mast cells, okay? All right. And part of that is getting yeast under control. And then number 4, often when you have this kind of sensitivity, Bartonella is part of it. It's just been something I've learned over time. Okay, so how do I approach somebody in this situation? I first of all start by getting them into a Gupta, Primal Trust, or a DNRS. Okay, I just start there. And I try to see if at a first visit, if I can at least get them to start a quercetin and maybe a KPV and maybe a Zyrtec, all right? And I will just have them start one thing at a time. So I might have them just start by taking half a capsule of quercetin, trying to work up to a total of 500 milligrams twice a day. Quercetin comes as a 250 milligram capsule, at least the brand I like to use. I like using a brand product made by Thorne called Quercetin Phytosome. And if you can just get on any amount that you can tolerate and gradually try to work that up, okay? Try to see if you can at least get up to 250 milligrams twice a day. Once a person has done that, then I might add in a KPV. You've got to be careful with the KPV though, although it does sound like it would be a good thing. KPV also has some antimicrobial properties. And so it could be killing germs, triggering increased Herx reactions or cytokines that has a person feeling well or worse. So I wouldn't start with a KPV. I would get them on a quercetin first. Then I might come back and add in a KPV, okay? So once I've got them doing the limbic system retraining, and I've got them on maybe 1 or 2 things to help with stabilizing their mast cell activation syndrome, then and only then might I start working on things to kill yeast in the intestines, all right? And I would start very small. This is one situation where I would tend to use a substance that is a liquid anti-yeast medication because you can microdose, all right? So for instance, I might look at using a product by Research Nutritionals, which is called Elimicand, and that's ELMI-A-canned, C-A-N-D. And normally, when you're on full dosing of Elimicand, you would want to do 40 drops twice a day, but I would never start a sensitive person there. I might start a sensitive person on half a drop once a day. Half a drop, all right? So how do you do half a drop? Well, you put a drop in an ounce of water and you drink half an ounce. That's half a drop, okay? But you start very, very slow and you work up as tolerated, okay? So those are just some of the general principles. Getting through this can really be a difficult situation, I have to admit, but you can, especially if you throw in the limbic system retraining and you do some good work trying to stabilize your mast cells to begin with, okay? All right. Boy, I wish your 15-year-old well. All right. Thanks for the question. Hello, Sue. Let's see. I had an adverse reaction to Omnipaque, the contrast I used prior to a CT scan. My oncologist recommended 3 doses of prednisone prior to trying again with the Omnipaque. This really scares me. My question is, can chronic Lyme and mold sensitivity sufferers take and tolerate and survive prednisone? Oh boy, it's a hard question. So one thing we generally, all of us have been taught that manage tick-borne infections is try to avoid using things that suppress the immune system, like prednisone, okay? And prednisone can suppress the immune system, which can make your tick-borne infections become more active. We see that happen, okay? On the other hand, there are situations where you just may not have another choice. it's not a good situation, right? But I mean, I would be trying to work with your oncologist to see if there's another thing that they can do besides using the omnipaque. Is there another way to do the imaging? But if all that they can come up with is you got to do it, then these are situations where it's not good, but sometimes that's what you got to do. The one thing that if I have people that need to be on steroids for a period of time or on immune suppression agents, that I want to be clear about doing is to try to have them on germ killers at the same time to try to suppress the germ load from taking off while they're on those steroids, okay? So germ killers can be your herbal antibiotics, germ killers can be your prescriptive antibiotics, okay? And I hope, given the complexity of the situation, that you're working with a Lyme doctor who can help direct that with you as well too, all right? Good luck to you, Sue. Hello, Christy. Let's see, Dr. Ross. I don't have a Lyme literate doc in my area of the world to help write prescriptions according to your recommendations. Could I treat Babesia with herbal approach you recommend with some success? So the answer is I have seen people that follow all herbal regimens to deal with Babesia get better. Okay, I have seen that happen. And the strongest way to do that, as you've seen in my article about how do you kill Babesia, would be to do a cryptolepis by itself and try to work up to 5 milliliters 3 times a day, and then add in artemisinin at some point into that too. Now, I use artemisinin, I recommend it a different way than a lot of doctors do, and that is I have people pulse it. And generally, I don't like pulsing antibiotics, but this is one situation I do it in. So what we know about artemisinin is that your liver develops enzymes that can deactivate it after you've used it a number of days in a row. So the Chinese, in looking at this, and they're using artemisinin to treat malaria, came up with the idea of using 3 days at really high doses and then being off for 11 days. And I've applied that to the world of Babesia management in my practice as well too. And so I usually will have an adult try to get up to anywhere from 300 to 500 milligrams of artemisinin 3 times a day for 3 days in a row, and then be off of it for 11 days. In a sensitive person, I would start at 100 milligrams 3 times a day, see how you tolerate the first round. If you tolerate it fairly well, then go up to 200 milligrams 3 times a day. If you're a larger adult, see if you can gradually work up to 500 milligrams 3 times a day, 3 days on, 11 days off, okay? So the answer is, yeah, it could work. Now, the only caveat I'm going to give you is that if you happen to have Babesia, that is the Babesia Odocoilei strain, I'm not clear it's going to work as well for you, okay? And I think if you participated, if you're not familiar with Babesia Odocoilei, I'm not going to spend a lot of time going through it right now. Last week, re-look at last week's webinar on YouTube. We spent a lot of time talking about Babesia Odocoilei, and one of my intentions is probably to take a large sector of that and turn it into a recording in an article coming up that will focus just on Babesia Odocoilei using that recording from last week as a cornerstone of it. I hope y'all can appreciate it. I haven't quite been doing a lot of new articles here recently because just getting a practice reopened is taking a lot of my time. But I'm getting to the point now that I think I should be able to start contributing new articles and new help for you down the road with further recordings and all that too. All right. All right. So for everyone who's wondering what I'm talking about with artemisinin and with the cryptolepis, I'm going to just share an article with you here. All right, so if we look at my infection plans and my Lymeology guides, if you were to take a look at my article on how to deal with Babesia, I do have in here an all herbal protocol, right? So I call these my tier 2 Babesia regimens. They work about 75 to 80% of the time, and that is to do cryptolepis, all right? And then you could combine it with this artemisinin that I mentioned here, okay? Now, and then down here, I talk about how to build an herbal medicine-only regimen, and that is, I say, start with the cryptolepis, and then add artemisinin, Or you could, if that's not working well for you, you could look at doing a combination tincture that has Cryptolepis, Acida and Alcornia in it. We call that a CSA tincture, and I talk about how to do that here too. Okay. All right. Good luck to you, Christy. Hello, Amy. Let's see. Hi, Dr. Ross. I'm a 30-year-old female with no past medical history. I got bit and 7 to 8 weeks later developed neuropathy, including tingling in my hands and feet, burning in my thighs, and dizziness and nausea. I was IGeneX fish positive for Bartonella and IgG positive for Babesia. I've been treating for 9 months and no improvements with an LMD. I'm concerned about mold and came back positive for 15 of 16 mycotoxins in real-time lab. Could this halt my progress? My LMD doesn't seem to think it's an issue, and I feel like I need a new doctor. Could the burning on my skin be MCAS? All right, so the burning sensations that you're describing, the tingling you described initially, the dizziness, a lot of that is neuropathy, all right, meaning nerve injury. Now, that nerve injury could be because of Bartonella and even Babesia, although I'd lean more towards the Bartonella, giving you an issue there, directly injuring the nerves, okay? But the other thing that can injure nerves and suppress their function is mold toxicity. So mold toxicity could be a factor in this. It may not entirely explain what's happening with you and why you're not having progress, but I will tell you, I've seen enough times that when my patients, that we get to a point that we're doing good treatment for a Bartonella, we're doing good treatment for Borrelia, and a lot of their neuropathy symptoms are not improving, and we discover that they have mold toxicity over time. By addressing the mold toxicity, that's an added factor that helps lead to improvement, okay? So keep in mind with these tick-borne infections and all of these conditions that it may be that there are many things that add together to create the complexity of the illness, okay? So those many things could be poor sleep, stressors in your life could be another one of those factors. Having a tick-borne infection, having mold toxicity, these are all things that can add together. Having low thyroid, it all adds up to create the illness. And so sometimes what we need to do is just slowly start pulling out these things that are leading to the problem, all right? Of which, if you're not making adequate headway on a Bartonella treatment, then yeah, it's time to start thinking, could there be something else that's interfering? I don't know what you used on your Bartonella as to whether I would consider that adequate or not. But in terms of your question, could this be a factor? Yeah, mold toxicity could be a factor. Okay. All right. Good luck to you, Amy. Hello, Myra. Let's see. When do you use Otoba bark and cat's claw? Thank you. It's interesting. I know I still list it as something you can use to manage tick-borne infection, especially for Borrelia, okay? But in the real world of how I work, a number of years, about 4 or 5 years ago now, there were studies that came out of Johns Hopkins University that I think provided a lot of insights to many of us. We weren't aware of some of the things they found. What Johns Hopkins was doing is they were trying to look at what could they do to move what's known as persister Lyme and persister Bartonella treatments forward, all right? So what I mean by that, you're probably familiar with this, but we think that Borrelia and Bartonella have a growing state and a hibernating or persister state, and those are called persisters. We just discovered those within the last 5 to 10 years, and so we started wondering, do we need to do something to deal with those persisters? What we know is that most standard prescription antibiotics don't address the persisters. All right. So Johns Hopkins University started doing a number of studies about 4 or 5 years ago now, trying to look at what would kill persister Bartonella, what would kill persister Borrelia. And it opened our eyes up. up, all right? So one of the herbs that I thought had nothing to do with Bartonella and Borrelia is Cryptolepis. And I think these days that Cryptolepis is one of the strongest Bartonella and one of the strongest Borrelia herbs out there. I find it more potent in my practice than an Otoba and a cat's claw. The other thing that their studies showed, so Crypto in their studies was very effective against growing and persister Bartonella, growing and persister Borrelia, okay? The other one in their studies that got some good validation was the Japanese knotweed, which is good against growing and persister Bartonella and Borrelia. They did show in their studies that cat's claw is effective against growing and persister Borrelia. It doesn't have any activity against Bartonella. And in their studies, they did not look at Otoba. All right, so I have to admit, we have no science that tells us what Otoba does, okay? Historically, I found good improvements working with Otoba and cat's claw together. But after I learned more about the Crypto and Japanese knotweed, and also out of the Hopkins studies, we now know that your volatile oils like oregano, cinnamon, and clove are very effective against growing and persister Borrelia and Bartonella, and they break down biofilms. I started rethinking of how to work herbally, and I tend to find a Crypto Japanese knotweed or a Crypto liposomal cinnamon clove oregano regimen, or put all three together to be more effective and stronger than Otoba barking cat's claw. All right. Now, that's not to say that Otoba barking cat's claw won't work, because I did see many positive outcomes using that as my primary herbal remedy. But these days, my primary herbal remedy is to do the triple remedy of Japanese knotweed with Cryptolepis, with liposomal cinnamon clove oregano. Okay, that tends to be my go-to where I start when I'm working on these infections. Okay, all right. Good luck, Mary. Hello, Sandy. Let's see. Any suggestions for a good quality methylene blue? What do you think of Q-restrain autologous therapy for Lyme, Epstein-Barr, etc.? Thank you very much, Sandy. So I don't know what I think about the Q-restrain. I haven't seen that before. I'd have to look into it. Okay. All right. And then in terms of methylene blue, I tend not to use any methylene blue you can find online. The reason is you cannot trust the quality, especially contaminants. All right. If you are going to use something that you find online, make sure they send you a certificate or their certificate proving that they don't have heavy metal contaminants in their methylene blue is critical, all right? Keep in mind, methylene blue is easy to find online because it's not regulated as a drug online. It's regulated as a food or as a clothing dye, all right? And so it's easy to find online because it's a clothing dye, but things that are used for clothing are not cleaned or as cleanly, if you will, as toxin-free, if you will, as things that you might find through other avenues. So for methylene blue, I strongly recommend getting it through a compounding pharmacy with a prescription from your provider. And those compounding pharmacies, as part of the work they do, find clean sources that don't have your heavy metal contaminants in it. Okay? All right. Good luck to you, Sandy. Hello, Mira again. Let's see. Do you find Apollo Neuro or Pulsetto helpful? Thank you. So I've personally used the Apollo Neuro. And everyone, Apollo Neuro is a device you wear on your wrist or your ankle that sends vibrations through you that can help keep you asleep, can help put you to sleep. There's different patterns that can help calm you if you're anxious. They may even help with depression. There's been studies done looking at that too. It's developed by a neurologist. If you happen to combine it with an Oura Ring, so an Oura Ring being something you wear on your finger that measures your heart rate and body temperature and all that, the Oura kind of interprets your body state and can send signals to Apollo Neuro. and tell it when to fire away, if you will, right? So one way you can use it, for instance, is at night, if you wear your Oura Ring and your Apollo Neuro and you connect the two through the Apollo Neuro app, what'll happen is Oura starts detecting you might be waking up. It'll send signals to the Apollo Neuro to start vibrating on one of their sleep patterns, for instance, okay? And I have found that very helpful in my own life. And I know there's a number of people I've recommended it to that have found that helpful as well too. Okay. All right. So for those of you that want to know a little bit more about Apollo Neuro, let me take a look here. All right. So I've got an article, or this is the product page. Now, I don't sell this directly. You have to buy it through Apollo Neuro, but this is the site that you would use. And in terms of the kind of things that it has been shown to be very helpful for, based on their studies, 40% less stress, 11% increase in heart rate variability, lower heart rate, more time in sleep, faster physical recovery, deeper sleep, and improvements in focus and attention. And I would say my experience mirrors this as well too, okay? There also, I believe I have an article on my Apollo Neuro too. So this is the product page. Yeah, so here's a whole, oh, I guess I grabbed the wrong one. So here's an article I've written called Upgrade Your Heart Rate Variability, Enhance Sleep, Mood, Thinking, Immune Function, Vitality. And this also talks about the Apollo Neuro and how it can be very helpful for you as well too, okay? All right. All right, good luck to you. Hello, Jacqueline. Let's see. Hi, Dr. Ross. I have been treating my 11-year-old son for anaplasma and Lyme for 8 weeks. He was on doxycycline for 30 days and just finished that on Saturday. He has still a lot of pain and on Tylenol and ibuprofen around the clock. Is there anything else can be done for his pain? So first, I hope you're talking to his doctor about that, okay? Because obviously I'm kind of limited to what I can do without seeing your son and examining him and everything else too, okay? In terms of things I like to use in tick-borne infections to help with pain is I want to work to lower inflammation chemicals made by your immune system called cytokines, all right? So cytokines are made by white blood cells whenever they see an infection or a mold toxin or yeast in your intestines or COVID in you. I mean, this is the key thing that white blood cells make. And the purpose of cytokines, or they make cytokines, and the purpose is to turn the immune system on. So on the one hand, cytokines are good. They cause more white blood cells to be made. They help drive those white blood cells to where the infection is, and they help the white blood cells work better, okay? All right, so those are all very positive things about cytokines. However, in these illnesses, they often get overproduced, and too many cytokines make you hurt all over, give you brain fog, give you fatigue, etc. They can interfere with how your hormonal systems work, all right? So, you know, what I like to use is something that's more targeted at lowering cytokines. And I don't think that your Tylenol ibuprofens are going to do that, all right? They're going to be more oriented at a group of inflammatory chemicals, which are called prostaglandin-based inflammatory chemicals, rather than inflammation triggered by infection. And so what I like using in these situations, and it would be safe to use an 11-year-old too, is I like using curcumin. Curcumin is a component of turmeric, and it gets inside of white blood cells and limits the production line. It interferes with the production line. For an 11-year-old, you might start at 500 milligrams twice a day, but you could easily go up to 3 times a day if you needed to, okay? And the product I like using for it, and this is just based on effectiveness that I've seen in my practice, is a product made by Thorne called Curcumin phytosome. I'll show it to you here in a minute. As a phytosome, it means it's microscopically wrapped in fat to increase its absorption. Typically, curcumin and other components of turmeric, curcumin comes from the Indian seasoning turmeric, are just not well absorbed in the stomach. So you need a preparation that's going to get them well absorbed, all right? So for an 11-year-old, in my practice in the past, I would have used curcumin as that thorn curcumin phytosome. I would start at 500 milligrams twice a day. And for my patients, I might go up to 500 milligrams 3 times a day, okay? All right. In addition, when you have acute infection like this, the immune system in trying to get rid of these agents is not only overproducing cytokines, but it's being told to overproduce those cytokines. And what tells it to overproduce those cytokines is the immune system releasing a bunch of oxidizing agents to help poison those germs, okay? Now, those oxidizing agents are the signal to your white blood cells to make cytokines. So you can block that signal by lowering it, all right? And so the way you can do that is a very good antioxidant to use in acute situations like this. And also it's useful for helping with detox through another mechanism, and that's to use glutathione. And I like using a liposomal glutathione so it gets well absorbed, because glutathione also is not that well absorbed. And the product that I have had most success with, and they've got great science showing it is well absorbed, is a product made by a company called Research Nutritionals, and that product is called Tri-Fortify, TRI-FORTIFY, and that's by Research Nutritionals, okay? For your son, I might do about 3/4 of a teaspoon to 1 teaspoonful once a day. So you could do curcumin along with that. And that would be my approach in an 11-year-old. But I would also want to be coming back to figure out why 30 days later, the pain is not getting any better. And is there a change in treatment that's needed for the tick-borne infections as well too? Okay, all right. So let me just do a screen share here for you. All right, so in terms of those 2 products that I was just telling you about, again, the thorn product is that curcumin phytosome, and where are we here? It's this product right here. Okay, that product right there. And then in terms of the Tri-Fortify products, this is my Research Nutritionals page, and you would take a look all the way down here. These are all, and there's a variety of them. Okay, there's 6 different ways you can get it. There's 2 flavors and 3 different sizes on each of those flavors, okay? But that's the Tri-Fortify that I was telling you about too. And good luck. Good luck with your son. Yeah. I assume a son. Yep, there was the word son in there. Okay, good. Hello, Linda. Let's see. After many dark years, I now test negative for Lyme and Bartonella IGeneX lab, but have lingering symptoms that flare up. Shaking inside, central nervous system, AFib. I get relief from azoles, methylene blue, and herbals. Will have heart surgery soon. Could test be false negative. I spent thousands of dollars and I'm tapped out. Recommendations. So what I would tell you is there is no testing that has ever been validated. Do you hear the word validated? To show when tick-borne infections are out of you. All right. So the problem in relying on IGeneX, which is mainly doing antibody testing, is when you have negative antibodies, it could be that the germ is gone and your immune system is no longer reacting to it, or it could be that the germs are really active. They're releasing chemicals that are suppressing the immune system, making it so you don't make the antibodies, okay? The other thing that IGeneX, there's a type of test they do called FISH testing, which is a microscope exam to see if they actually see the infections. But keep in mind, that type of testing, also known as direct testing, is not entirely accurate at finding things that don't readily live in the blood. So like your Borrelia and your Babesias are not, I'm sorry, and your Bartonellas don't readily live in the blood. So a fish testing being negative just may mean it wasn't in that allotment of blood that they drew out at the same time, okay? Now, a more recent way that some of my colleagues are looking to see if an infection is gone is to use a type of direct test method that is done by a lab called T-Labs. T-Labs was set up by Dr. Mosignani, who happens to be a big name in Bartonella, all right? Now, Dr. Mosignani thinks that his test is very accurate under the microscope at seeing whether the germs are there. And when I talked with him directly about this a number of weeks ago, I said, have you ever done any studies that prove how accurate your test is at finding infection when it's there? And his response is, I think it is. I think it's very accurate. And I'm like, well, how do you know? Because again, I think for Babesia, it probably does make sense. Babesia lives in your blood. But for things like Bartonella and Borrelia, a lot of that is going to be more related to, was it swimming by the needle when you drew the blood? And those germs do not readily live within tissues, okay? So unfortunately, the truth is, even though a lot of my colleagues try to rely on testing to see where they are, we don't have validated ways of knowing if you're done with treatment. We just don't. So sometimes we have to still rely on symptoms. If the symptoms say it's still there, then we keep moving on. We keep killing germs and we keep doing the supports that we need to, okay? So I know you're asking if I would tell you what to take here. I'm not at this point. I would need to ask you a lot more questions and try to understand what you've been on before too. The main point I want to make with your question though is that there is not a done test or where are we test in tick-borne infections. That's accurate. That's been validated and shown to really indicate when a germ is gone. Okay? All right. Good luck to you, Linda. Linda says your website is my lifeline. Thank you, Linda. I'm glad it gives you. I'm glad it gives you help. That's why I maintain that site. Okay. Yeah. So Susan says, how do you feel about plasmapheresis complications from thickening blood supply? So plasmapheresis, everyone, is a way of cleaning your blood. Basically, you have a big IV line that's put in one arm, and you pull the liquid part of your blood out, which is the plasma, leaving the cells behind. And then that plasma is filtered and cleaned, if you will, and then it's put back and it's pulled off. It's actually removed. And then you wind up putting other liquid back in, basically, all right? So when you clean out the plasma, things that can be removed would be toxins might be removed, mainly toxins. I think I have heard a number of talks about this, looking at it for Lyme, and I keep hearing from people, even administering it, that it gives mixed results, all right? It's also extremely expensive. I think you're talking like anywhere from $5,000 to $10,000 a treatment. And so I think we're in the early days of understanding whether it will make a difference for people or not. Okay. All right. Good luck, Susan. Hello, Debbie. Let's see. I have been experiencing a lot of head pressure. It goes up the back of my head to the crown, out to the sides of my head, and it does radiate into my face. I'm trying to figure out if this is from Borrelia or from Babesia. I tested positive through immunoglobulin IgM for Lyme and Babesia. I've had chronic Lyme for years, but this has recently flared. So I tend to think of head pressure, as you describe, being more Borrelia and or Bartonella, okay? But you would also need a good exam to see if there's something else going on within the bone structures that might be triggering that. I hope you have discussed it over with your physician so they can examine you and see if there's some other possibilities behind that too. Okay? All right. Good luck, Debbie. Hello, Katie. Let's see. Dr. Marty Ross. I have had 3 IGenic tests that say I only have microti, and then I took T labs and it says positive Odocoilei. But in small print, it says it may detect other Babesia species, thus a positive result doesn't necessarily identify the species detected. I am now not sure what to think. Do I trust I have Odocoilei? Thanks, you are awesome. Thanks, Katie. I appreciate that. So IGeneX, let's talk about what IGeneX is capable of doing with their test. Okay, so IGeneX has an immunoblot test and also something called a FISH test. The immunoblot looks to see, are you making antibodies against Babesia? And IGeneX has the ability to see if you're making antibodies specifically against Babesia microti and against Babesia odocoilei. And then in addition, it can tell if you are making antibodies against the species of Babesia, meaning it could detect if you have other strains for which they can't specifically test for, like a Babesia Odocoilei, okay? But it's in terms of determining if you have Babesia, the sensitivity of an immunoblot method, this antibody detection method, is about 94%. So it can miss it 6% of the time, all right? In terms of the Babesia Odocoilei then being seen on T labs, it's a pretty, so in medicine, we recognize 2 terms, something called sensitivity, which is the ability for a test to find something when it's there. And specificity means that when it finds it, is it really accurate? Did it really find what it thinks it detected? Okay, that's kind of a way of looking at it. So the way that the T-Lab test is done, they use a genetic marker that attaches to the genetic material of Babesia Odocoilei. That's pretty hard to be a false positive. So in other words, probably a pretty sensitive test, all right? If I got that kind of result back on a patient of mine, I acknowledge nothing is perfect in the world of testing. But for that, I probably would follow through and try to treat for Babesia Odocoilei. Okay, all right. Good luck. Oh, and then in terms of another test that IGeneX does for Babesia, it's called their FISH test, which is also a microscope exam. But their marker applies to the genetic material of Babesia, but it's a genus test. It's not a specific species test. Okay, all right. Good luck, Katie. Hello, John. Let's see. Hyperthermia treatment, my opinion. Dr. Mark Hyman says it was game changer for him personally in treating his Berlin Babesia. Any clinic recommendations? Mexico, Germany. Thank you. All right. So the thing that and I know what Mark Hyman says, and I'm not going to dispute him. Keep in mind, so when you get hyperthermia done, which means heating up extremely hot, and in fact, the German clinic, which is called Clinic St. George, I think it's Klinik St. George, they heat you up so high that they give you sedation to keep you comfortable while they heat you up, okay? Heating can kill germs. I fully acknowledge that, all right? In fact, it's an old-time way that syphilis used to be treated before antibiotics. However, they would claim at Clinic St. George that it can kill Borrelia wherever it lives in the body. Keep in mind that while you're there at Clinic St. George, in addition to trying to hyperheat you and kill germs, they're giving you IV antibiotics and I believe IV ozone while you're there. So you're on other things that might potentially improve your situation. And you're getting these while you're all heated up. So you even get good circulation, okay? So what I have found in my patients generally is that people that go to Clinic St. George, and I can't comment about Mexico, but Clinic St. George, they do get improvements, but they don't last. They eventually come back. So it's not a thing that's going to cure you. It's really critical that you still follow through and keep germ killing once you get back. What we don't know from what Dr. Mark Hyman writes about is, did he keep doing something else to kill his germs when he came back? Okay, so I just want to say that to you, okay? And I don't, the big clinic that people go to is Clinic St. George. I'm not familiar who's doing it down in Mexico exactly. Okay. All right. And actually, I probably should, let's look at something here real quick. I'm going to do a screen share. And what I'm interested in is LymeDisease.org has a project called My Lyme Data, and they periodically take people that have enrolled that live with Lyme, and they ask them questions. And a number of years ago, they did a study looking at what worked for people and what side effects did they have when they did alternative medicines, of which hyperthermia was one of those. And let's go look at this. They have a whole interactive table here. Okay, so hyperthermia, this is their hyperthermia result. It looks like hyperthermia, 18% of people in their survey had responded they had tried it, and about 31% of people found it moderately effective, and 14% of people found it very effective. 48% said they didn't know, and 6% said it just didn't help them at all. Okay. So the one thing I would point out, this 45% figure is made up of people that moderately and very effective. What I want to let you know, whenever you see 40%-ish, even like Rife machines, 35%, oxygen therapies like ozone, 40% helpful. 40% can also be what we know happens in what's called a placebo effect. So let me go back here and talk about that. So in medicine, whenever a drug is approved, to get it approved, they have to do a study. In their studies, they have to look at what happens in what's known as a double-blind randomized study, where during the study, somebody gets the drug and somebody gets a placebo sugar pill. And during the study, these people don't know what they got, and the researchers collecting information about them don't know who got what either. Okay, so there can be no biases that alter the outcome of what's perceived happens, all right? And what we know in double-blind randomized controlled studies is that 40% of people get benefits by taking the sugar pill. That's called a placebo effect, okay? It's about 40%. It's recognized that whenever you take something you think is going to help you or might help you, there's a 40% chance you're going to feel better for it, okay? So is that what's happening with Rife? Is that what's happening with hyperbaric oxygen? Is that what's happening with hyperthermia? I don't know. But what I do know is that the amount of people that get benefit fits within that window of what we see benefit people get from placebo effect too. So I just have to raise that question, okay? Now, I'm not saying a placebo effect's bad. It's a healing effect. So if you get healing because you're taking something you think is going to work for you and you feel better, great. That is a good thing, okay? All right. Hello, Mary. If someone refuses to treat for tick-borne infections, would you still treat for things like POTS, inflammation, sleep issues, or chronic fatigue? Is there any point? And or have you seen a connection or worked with patients who have tick-borne illnesses and Ehrlos Danlos Syndrome? All right. So, you know, you can have people live a better quality of life by treating the manifestations of your tick-borne illness while you don't do anything to knock down the germ load. It's possible. I've seen it happen before. Okay. I think it's probably better to knock those germs out or down a lot, but it is a possibility to do that. Okay. And then tick-borne illness and Ehrlos Danlos. Ehrlos Danlos is a condition where you have lax joints. You have what I call stretchy tendons and ligaments around your joints. And these are people with really loose joints and cracking and popping joints. The problem with those loose and cracking joints is they can actually hurt. They're so mobile, you actually get a lot of pain in those areas, all right? Tick-borne illnesses may make the condition worse. I'm not clear on my reading if tick-borne infections cause Ehrlos Danlos or lax joints, but it can make it worse. And specifically, when we look at tick-borne infection, especially Borrelia, it releases a lot of enzymes to burrow its way into tissues. And it likes to hide deep within tissues that don't have good blood flow because oxygen in your blood is toxic to those germs, okay? But in getting in, burrowing itself deep into these tissues, it releases enzymes that can break down the collagen and connective tissue. So in terms, does it cause Ehrlos Danlos? I don't know, and I don't think so, actually. But can it make it worse? Yeah, it can, okay? All right. Good luck, Mary. Let's see here. Hello, Paula. What can I take to thin out my blood? It's very thick. I'm assuming it's fibrin nest from Bartonella. So that used to be a number of years ago, we were all considering that chronic infection may trigger what I call sticky blood or thick blood. And that is whenever you have chronic infections, one of the inflammation reactions that you can get is your immune system will manufacture a lot more of the blood clotting protein called fibrin. And it actually can make your blood stickier or more sludgy, okay? In addition, we now recognize that Bartonella likes to wrap itself up in fibrin. And so you may have these floating around nest of Bartonella and fibrin, or we think they get stuck on the blood vessel walls, all right? So what I'd like to do especially for the fibrin nest, and also can help with sticky blood from just overproduction of fibrin, is lumbar kinase. That's what I have found helpful. I like to have people take a 20 milligram pill and work up to 1 pill twice a day. I will also let you know that for some people, being on injections of low doses of heparin can sometimes make a difference for that as well too. Okay? All right. Thanks, Paula. Hello, Eloise. Let's see. Hi, Dr. Ross. We feel stuck treating our 7-year-old with Bartonella as he had elongated QT on clarithromycin, so we had to switch antibiotic class. Tried Augmentin, then Ceftonir with Alinea with some beyond balance herbs. He has PANS, probably Sears, and Marcon, so very sensitive system. We did a whole microbiome gut genome test with Therabiome, and it shows a very compromised gut lining, poor biodiversity, low small chain fatty acid production, low GABA. Does it make sense to heal more the gut lining and improve diversity for, say, 4 to 6 weeks before restarting antibiotics and herbals? And what about trying azithromycin next? Same class, but possibly less risk of prolonged QT? Or have you seen results with just herbals in children? Lyme literate naturopathic doctor thinks he needs IVIG at this point, although could make things worse because underlying infection is not treated. Thank you. P.S. should add, I use peptides with him like lorazepatide and adding microdoses of KPV now. A Selank is needed. All right. So I'm just going to give a few comments because I would need to ask you a lot more questions about your son too. But when I've got somebody that has a very disturbed GI system and you're dealing with situations like you've discussed with your son, including the PANS and the Bartonella, et cetera, I'm going to err on the side of going with herbal antibiotic regimens in my practice rather than going with the prescriptions. And when you go with the herbals, I have not seen any of the herbal antibiotics cause QT interval prolongation. And even though they're going to try to use the azithromycin because they think it's going to have less problems on QT, it still could. Okay. So in terms of the herbals, what I like using is a cryptolepis, Japanese knotweed, and even cinnamon clove oregano combination. You could talk with your LLND about that and see what they think. In general, the herbals tend to be less destructive and harmful to the gut lining, to your microbiome, than the prescriptives are. All right. Given the sensitivities of your son, I would want to start with a low dose on just one of those herbs, and I might make it the cryptolepis, the one that I start with first. But your naturopath should know how to work with that. Okay. All right. Good luck to you. Good luck to your son. Hello, Joe. Hi, Dr. Ross. Thanks for hosting. These are for all the great info you share with the Lyme community. You're welcome. I've been feeling stuck with treatment. I have treated mostly with herbs since February. I took a week. Let's see. I'm sorry. I just got disturbed by my phone here. Just a second. All right. I've been feeling stuck with treatment. I have treated mostly with herbs since February. I took a week of Malarone and ended up in the ER 3 times within a week of stopping because I couldn't handle it. Had extreme shortness of breath and extreme weakness. Really thought I was going to die. On IGeneX, I had positive, likely positive Babesia Odocoilei, but Babesia genus was negative. None of the other tick-borne infections showed positive. I am thinking I must have Odocoilei because I still feel so bad. Recently been using crypto, sweet annie, skullcap, knotweed, lumbro, and the sweet annie seems to be causing intolerable neck pain, stiffness with really intense brain fog. I feel stuck because I feel like when I push harder with antimalarials, I feel like I'm going to die. And with the herbs, while they seem helpful on the earlier stages, I just don't feel like I am making progress anymore. All right. Joe, that's complex. I feel for you. I'm not going to be able to easily solve that or come up with recommendations here in this kind of format. I would need to ask you a lot more questions about your overall symptoms and what kind of reactions you've had on different things you've tried before too. Okay. So I'm sorry, I'm not going to be able to give you a response here on that one. Okay. All right. Good luck to you, Joe. All right, everyone. I am done for tonight. So I'm joining a friend here this evening to go see the Kraken play hockey here at in Seattle at our Climate Pledge Arena. And I haven't, since coming back to Seattle, I haven't seen a hockey game yet. And that's one of the things I like to do. And that's one of the reasons I'm glad I came back to Seattle. So anyhow, I've got to go meet her here in a little bit, and then we'll be off. So I want to wrap up and not run too long tonight. Keep your eyes. I'm glad to have been here with you tonight, though, and I look forward to being with you again next week. So I hope tomorrow morning when you get the email that you'll sign up for next week's webinar. All right. And look for that email somewhere probably around 10 or 11 tomorrow morning after I've had a chance to create the summary and get the YouTube video posted too. Okay. All right. Good night, everyone.